Good evening, everyone. I'm Lissy Bastian. It's Friday, September 18th. Thanks for staying with us. The Public Hospitals Authority renewing its appeal to members of the public to collect stored bodies at the morgue at Princess Margaret Hospital, citing that the morgue has an excess of over 150 bodies in storage, well beyond its maximum capacity of 66 bodies. In a release yesterday, the PHA says this excess of storage is due to the increase in deceased individuals as a result of COVID-19. PHA officials say it will seek the required legal authority to remove the remains if bodies are not removed in a timely manner. PHA's release also indicating that while the Public Hospitals Authority attempts to mitigate its limited storage capacity with the use of a temporary repository, the increasing number of bodies threatens morgue operations, adding that recently and regrettably, the overflow conditions compromised the integrity of a body in long-term storage. Existing protocols and regulations are being strictly enforced to expedite the notification and retrieval of bodies from the morgue in a timely manner. PHA officials inviting family members or their legal representatives to contact management at the Princess Margaret Hospital to arrange for the collection of their loved ones. The PHA is also requesting funeral homes who are under contract by deceased families to accelerate the removal of bodies in preparation for burial. The Ministry of Health yesterday confirmed 90 additional cases of COVID-19 for the country. The total confirmed cases in country now stands at 3,177. 79 of those new cases are here on New Providence, 6 on Grand Bahama, 2 on Eleuthera, 1 on Andros, and 2 with locations pending. The Ministry of Health also confirming 5 additional deaths under investigation. This increases the number of deaths in that category to 17, and the death toll remains at 69. To date, of the 3,177 cases, 1,626 have recovered, 1,456 are active, with 72 of them hospitalized. 16,386 tests have been completed to date. The government has committed to extending the National Food Distribution Program to the end of October. This coming from Minister of Social Services and Urban Development Frankie Campbell. The National Food Program was established by the Prime Minister to assist with the basic needs of food assistance to the citizens and residents of the country due to the impact of COVID-19. Its original time frame was from the last week in May to the end of August, and so far $13.2 million has been given to the program to date.
The National Food Distribution Task Force has distributed food parcels and vouchers to approximately 55,078 households throughout the Bahamas up to September 12th. The need for continued food assistance through the task force is still of paramount importance, and as such, the government of the Bahamas has committed to the continued partnership to the end of October 2020. The process of feeding our fellow brothers and sisters remains a major priority for the government of the Bahamas. Therefore, we wish to advise that persons in need of food assistance can apply to the Department of Social Services, as well as various non-governmental organizations which provide food assistance to the most vulnerable.
Minister Campbell noted that persons should not apply to both entities for food assistance. The government also partnered with 16 non-governmental organizations in 14 Family Island districts and spent a total of $31,000 to assist with feeding programs.
In a combined initiative, the Ministry of Social Services and Urban Development and the Ministry of Health worked in tandem to relocate the boarders from the Princess Margaret Hospital to senior residential facilities. This joint effort is budgeted to cost approximately $800,000 in the first year for care and needs of the residents. The relocation of the boarders creates much needed space for critical care.
The United States government gifting the Bahamas with emergency relief equipment and supplies this morning at the Royal Bahamas Defense Force Base, Coral Harbor. The National Emergency Management Agency, NEMA, accepted the gift on behalf of the government. Officials from both the government of the Bahamas and the United States were on hand for the handover. Minister of State for Disaster, Preparedness Management and Reconstruction, Iram Lewis, says that many countries, non-governmental organizations, and individuals have reached out to the Bahamas over the years for assisting with preparing for and responding to disasters.
And today, we are gathered once again to accept and express gratitude for the very generous donation of a variety of disaster equipment and supplies with values approximately, I said earlier, some $3.6 million, $3.84 million. This donation, I emphasize, in considering the economic challenges, but most certainly add value to our disaster relief.
The minister added that over the last 5 months, his ministry has been in conversations with officials from the U.S. Embassy in the capital and other U.S. agencies such as the United States Northern Command to establish how the U.S. government can help the country in its ongoing preparedness for major storms.
12, 16 feet, medical water rescue boats that are outfitted with 40 horsepower Yamaha engines, safety stretchers, life vests, and 20-foot trailers. This total package of 12 boats, 12 trailers, 12 engines, 12 stretchers, and 144 life vests is valued at $151,778.70. Emergency relief supplies valued at $45,000 to augment supplies in the 3 emergency relief houses that are situated in Great Inagua, Grand Bahama, and here at the Coral Harbor Base.
Captain Stephen Russell, director at NEMA, says that today's presentation is a demonstration of a long and proven partnership, friendship, and the stability of programs with the U.S. that have endured over the years. Deputy Prime Minister and Minister of Finance Peter Turnquest still holding hope that the tourism industry will bounce back despite many major hotels and resorts not reopening in time for the October 15th phased reopening. The DPM says that although the situation proves difficult, they were prepared for this outcome.
As we have said from the beginning, our plan recognized that we would not have any significant tourism activity until November timeframe. We're still hopeful that though the major hotels have announced that they may not be opening right away, that the smaller hotels will be open and we will start to see some activity, both here in New Providence as well as in the Family Islands. We know that the Family Islands, for instance, bring high value tourism. And so that will go some way to providing opportunities for residents in those communities to contribute to the overall economic well-being of the country.
Speaking on the sidelines of a gift handover from the U.S. government to NEMA officials at the Royal Bahamas Defense Force Base, the DPM says that the Ministry of Tourism and Aviation continues to work with tourism stakeholders to bring back as many tourists as they can as quickly as possible and establishing protocols as to how they will do that safely. When asked if he thought the extension of the emergency powers orders to October 31st would affect the reopening of the economy, Mr. Turnquest had this to say.
The extension of the emergency power orders itself doesn't necessarily affect the opening and closing of the economy. The Prime Minister as the competent authority has that power through that order, but it doesn't necessarily mean that he has to exercise it. So this is just making the provision in the event that they have to respond to a surge in cases.
The DPM contends that with continued diligence and discipline amongst everyone, we can hopefully achieve the objective of bringing the COVID-19 cases down to an acceptable level so that the Bahamas can achieve a full reopening of the economy. You're watching JCN News. When we return, $800,000 allocated to relocate PMH borders. Another homicide in the capital and a Nassau Village resident assisting his own. Stay with us.
This segment of the news was brought to you by Alive.